with short procedures and excellent outcomes. Now, short procedure and excellent outcomes means we have a high income. You see 10 patients booked in the OR. Cataract surgery at AKU costs around 2 or 3 lakh, and it's a 5 to 10 minutes procedure. So if you start to make the calculations, in a morning OR 3 4 hours, you can do 5 6 cataract surgeries. That's 2 into 5, 10 lakh per day on your OR day. So extremely strong for small procedures, excellent outcomes, good income, minimum on calls, minimum emergencies. So these are a few concepts about lifestyle in ophthalmology, which I think everyone should appreciate, and we are very thankful for this lifestyle. Then, secondly, um, some some people think that ophthalmology does not have significant depth, but I will tell you a few concepts here. That we do have diverse subspecialties. The basic ones are retina, cornea, glaucoma. But if you keep on going, we have ocular oncology, pediatric ophthalmology, neuro-ophthalmology, refractive surgery, and many more. So we have a lot of depth and breadth to ophthalmology, which I will tell you more about in a few minutes. Then secondly, we are all very tech savvy because the equipment is quite expensive. We have these basic slit lamps, they are very basic, but then we have lasers, we have imaging modalities, OCT and FFAs, autofluorescence, visual fields, all of them are quite tech savvy, including artificial intelligence. Um, Ophthalmology was a significant leader in artificial intelligence because the imaging that we had regarding the retina pictures, they were put into the AI programs for deep learning, and they would give out generate images regarding diabetic retinopathy. So quite tech savvy, and especially yes, the microsurgical instruments. I don't have any microsurgical instrument to show, but they are, it's again, as I mentioned, it's a whole other world, not just diagnosing and managing the patient, but actually getting to perform microsurgery inside the eye using high tech, hi fi equipment. All of that is quite amazing, at least to me. So, a few myths about ophthalmology. A lot of people say that you cannot do microsurgery if you have hand tremors. So, ophthalmology is obviously quite a precise field as far as surgery is concerned, but let me tell you that it is completely an acquired skill. You practice as a resident first year, second year, third year. All of you who decide to get into ophthalmology will acquire this skill eventually. It's nothing to be scared of. Even if you have hand tremors in the beginning, as long as they are not quite significant, you can still perform ocular surgery. We have senior professors who have hand tremors due to age, but still they perform surgery because there is significant margin of error. So nothing to worry about here. Then people think that there are lack of opportunities due to limited seats. Again, this is one of the biggest myths, and you need to understand a concept here which I've thought about a lot. The concept is, for example, we have 16 students here, and 16 students from, suppose, let's say, one medical college of 500 students. Now, if you say that Shifa has only 2 seats in ophthalmology, but at the same time, amongst those 500 medical students, we have only 16 individuals who have decided to apply for these 2 seats. So you see that the whole applicant pool is significantly decreased for those 2 seats, and the rest of your batch mates, 90% of them, they would go into medicine, surgery, obgyn, peds. And let me tell you this, these fields are currently extremely saturated in Pakistan. Ophthalmology, you may think it's saturated, but actually the applicant pool is extremely limited, and we have a lot of vacancies in ophthalmology. We have very limited applicants. So this is actually a very golden opportunity, a good time for all of you to apply. You are 16 people here, not actually 16, but jitne bhi ho. If all of you today decide to go into ophthalmology, I am pretty sure all of you will get uh, a good place in Pakistan, definitely, and even in US or other places, you do have a good chance because you have very limited applicants. So again, nothing to worry about. There are significant seats. We have extremely limited applicants. Even at AKU, sometimes we have vacant seats. So again, uh, this is just a myth which the average person thinks that this is a problem, but I'm telling you it's not a problem. So moving on, people think there's a lack of depth in this field. Again, as I mentioned, inside the microscope, we have our whole universe. We have our extremely diverse subspecialties, so many procedures, um, nothing to be worried about. Okay, then some people say that we are not proper doctors. Um, we don't want to treat fever, we don't want to treat diarrhea, we don't want to treat constipation. We are very happy in our own universe treating retina, cornea, glaucoma, everything within our ophthalmology. We can treat anything else because, again, all of us had the MBBS degree, all of us had the license. And that's the best part. We have all the hospital privileges. If you want to admit the patient, you want to move into the emergency OR, we have surgical privileges. We have all the privileges that any doctor, proper doctor wants, but we don't use them because we have our own thing going on. So we don't want to be affiliated with inpatient systems. We can if you want to, but surgical daycare is much better. It's a better lifestyle. Surgical daycare means the patient comes in, gets the procedure, goes home. They don't stay overnight. We don't have the hassle of having interns to take care of them overnight. We don't have to stay overnight. Everything is daycare. So but again, we have all the privileges of proper doctors, and I will give you a few case examples as well. If you want to be, a big surgeon, so I will show you how within ophthalmology you can be a big surgeon as well. For example, oculoplastics, that's a proper surgical field in ophthalmology. I will show you a few cases about it. So again, people say small organ limited. All of these are myths. So moving on, I would like to share a few cases which I saw at AKU, which will show you the depth and breadth of ophthalmology. Just give me 1 second here to like वो करना है। Right. So this was one case I presented at American Society of Retina Specialists. This you need to make a list of all the institutes in Pakistan on the CPSV website, on the PMDC website. You need to go through all of them. You need to get out of your comfort zone. Nothing is easy. You you might have to compromise, either have to change the city or maybe an institute, not your best choice, but you can't have it all. Even in other specialties, you can't have it all. So there has to be some sort of compromise, but you need to apply in as many places as possible to secure your seat. Uh, I checked the website recently, CPSP. I think we have, yes, 87 CPSP approved programs of ophthalmology in Pakistan and 23 in Islamabad. This is a huge number, but the masses, the general average medical student, they don't know about all of these, and they don't go systematically through all of these lists. So to be a good applicant, strong, sharp applicant, you need to go through all of these lists and apply as in places as possible. So prospects in Pakistan include, you can do a fellowship in Pakistan. We have retina, we have glaucoma, we have lots of fellowships in Pakistan. We have this body called International Council of Ophthalmology, which connects residents and provides lots of opportunities for fellowships. There are other fellowship programs outside Pakistan. You can pursue them. You can join a teaching hospital in Pakistan. You can start a private practice at any eye center in Pakistan, or you can set up your own eye center. This is something very unique about ophthalmology, that we don't need to be affiliated with big hospital setups. You don't need an inpatient department. We just need one room for operation theater, one room for clinic, and one room for the waiting area. That's it. 3 rooms, you rent a building, and you start your own independent practice anywhere, anytime, after you become, a full-fledged ophthalmologist. Even during residency, people started. So again, we do not need to be affiliated with an inpatient, big setup, expensive department. We have our own thing going on, and we are very happy with that. Or you can move on to any other country. Um, Once you have done your residency, you get to realize that these licenses and fellowships, these are all, there are ways around it. So you can move to any other country after doing your residency here, and we'll talk about that. As far as the costs are concerned, at AKU, as I mentioned, we have a 2 lakh cataract surgery procedure, retinal surgery around 6 lakh, and short procedures, 5 minutes, 10 minutes in and out. Extremely good outcomes, extremely satisfactory. So here was a brief overview of how to start your own eye center after you get in residency. You can partner with sponsors. They are very happy to help. The pharmaceutical companies, the banks, the investor groups, or other ophthalmologists, they usually get together and they make their own eye center. This is a very, you know, a good opportunity once you are a full-fledged ophthalmologist. All you have to do is rent a building. You need to buy the required machinery, the OR equipment, the clinic equipment. Depending on the quality of the services, you can get them easily. You hire the technical staff, the optometrist, OR staff. You clear the government regulation. You start your marketing. You keep room for growth, and you have your own independent eye center anywhere you want. So no need to depend on any seats after you become an ophthalmologist. We have a lot of things going on. Now coming towards the most, I guess, weighted aspect of how to secure residency in ophthalmology in US. So this is the general career path of US any residency. You go into medicine, you go into the lowest merit possible, I don't know, family medicine, peds, neurology, whatever. You feel that you are, not up to the mark in that American system, whatever, but it's still difficult. You have to give your step 1, step 2, step 3 application, observerships, LORs, all of that. It's not easy. So this is again the whole graph of getting into US or any other seat. Coming towards ophthalmology, the concept I want to clarify is this is the additional requirement required for ophthalmology. In any case, you have to go through all of these things, right? But if you really want ophthalmology, which is definitely worth it, you have to put in a little bit of extra effort if you have, obviously that stamina and everything. The reason this extra growth curve here is, again, it's a very high merit, very competitive, and research is a core component of ophthalmology. So you probably need to do 1 year or 2 years of research and get some publications to have a chance of securing a seat. Again, the whole path is not easy. In any case, you are going through all of these difficulties. But if you add in the additional year of research, then you have a good chance of securing ophthalmology. So this is a very important concept that you need to understand. And then once you're in the residency of ophthalmology, then you go all the way up. So the concept here was that this is not easy in any case, right? If you are going to US, it's a whole big project. You need to take care of all of these things. But if you are tailored, you are smart, you make the choice of ophthalmology, it is quite doable, and you can. So here was a list of resources. No, not resources. So this was a YouTube video which I copied, ranked to match introduction to the ophthalmology match for residency. You can see the video, it's uploaded there. It gives you statistics of the ophthalmology match in 2018-2019 cycle. And what we see here is international applicants, 129, of them 61 submitted the rank list, of them 17 matched. Again, some might say these are depressing statistics, but I would say that if you there are tricks how to go about the system. You need to know, you need to understand the whole cycle, the whole unique aspects to the ophthalmology residency match. A few of those points I will discuss, but again, I'm not an expert in the residency. It is challenging, no doubt, but you can connect with other people. But let's just go over this. This is a YouTube video. You can go through it later on. So this was the scores of these matched individuals and these unmatched individuals, just to give you an overview. Then if you further look upon the literature on this specific topic, this was an excellent article published in the American Academy of Ophthalmology, Predictors of Matching in an Ophthalmology Residency Program. So what this article says is this many IMGs applied, these were the references, these were the statistics. You can look up this article online. I've given a brief summary of this article. Again, this is not my opinion, but this is just copy paste from this article. I thought it might help you. So what to do to actually secure your seat in the US? Get 3 LORs from US based ophthalmologists. This increases the odds of matching 6-fold. So you need 3 LORs, not 1, not 2, 3 from US based ophthalmologists. All of these things are extremely important. And the idea is, it's a checklist, right? It's a difficult, challenging journey. If you have all this checklist in you, then you can secure a residency seat. Publish research in high impact journals. This increases the odds of matching 3-fold. Get high USMLE scores, increases the odds of matching 3-fold. If you've gone through this checklist, you have all of these things, you can secure residency in US. Get US research experience, increases the odds of matching 3-fold. This is what the published literature said about getting a residency for IMGs. And then it further said what not to do. So postgraduate clinical training outside US decreases the odds of matching 4-fold. For example, I did my residency here. If I apply for residency, I will not have a good chance because I've already been trained. So they want fresh young graduates who they can train, who are competent enough with the previous checklist. So coming towards all of these conditions quickly, LOR is extremely important from US based ophthalmologists. These are general guidelines which I think you can get from any seminar on USMLEs. They will give you how to make the most of your observership or elective experience, how to get the maximum possible best LORs. So these are extremely important through electives, through research, through pre-residency research fellowship. Now, publish research in high impact journals. How to do that? What is a high impact journal? How many researchers do you need according to this article? So according to this article, they said you need only 1 published research, right? But 1 published research in a high impact journal with an impact factor of 3, which is not easy at all. Even I don't have a publication with an impact factor of more than 3. But those who have, those AQ graduates who have secured residency in US, they have gone through all of this struggle, hard work, and they have these publications in US and they have secured the residency seats. So if you want to pursue that pathway, you can. USMLE score is important in this context of step 1, step 2, step 3. I think they're also deciding to make it pass and fail. All of these general guidelines, you can understand them deeply from other USMLE resources. Coming towards, this was the table in that published literature. You can go through it. Now, here were a few tricks and tips when you decide to pursue in the US. You need to know the career dynamics of your field and your future subspecialty even as an applicant resident. Why is this important? Because if you just understand that after residency, when you come to fellowship, there is a huge vacancy in specialties such as pediatric ophthalmology, in specialties such as neuro-ophthalmology, and they want people in those specialties, but majority of the ophthalmologists, they don't pursue pediatric ophthalmology, neuro-ophthalmology, uveitis, these kind of fields. Why? There are separate dynamics within that field. But since all of you are here, this is again a concept that as international medical graduates you need to understand. And if you mention these things in your residency interview, for example, hopefully if you come to that stage, that I wish to pursue neuro-ophthalmology after I become an ophthalmology resident, they will look at you from a different angle because there is already a vacancy. It means you understand the career dynamics, and that you actually, if you want to pursue neuro-ophthalmology or pediatric, there is a vacancy there. So this is your, a trick that you can say during application of residencies, that you understand the field dynamics, the vacancies in the US, and you are making your personal statements accordingly. So this was just a trick. So there are a few residency case examples from AKU graduates. Again, as Shifa graduates, we tend to copy AKU a lot. So these were a few case examples of how the AKU graduates, they secure ophthalmology residency seats in the US. Again, not an easy thing, but it's a process, it's a journey. You go through all of these things step by step by step by step, and eventually you get there. So this guy, he was an exceptional candidate. All of ophthalmology applicants are exceptional candidates. He did his residency at Stanford Byers Eye Institute. He was of class of 2012, and he had excellent STEP scores. So what he actually had was a 21 publication at the time of application, and I believe he had 2 years of research dedicated in the US, and in his third year he secured his residency. So that is the extra effort that you need to put in, 1 or 2 years of research. Sorry. Right. So what he mentioned was research, contacts, visa status, all of these things are important to secure residency. This was another AKU graduate. He said that published research in high impact journals is the most important factor. He also did a few years of research in the US dedicated. So research in the US, I'll tell you a few things about that as well. So what are the resources that you can use along your journey? So you have a lot of networking events. We have subspecialty societies. For US, we have American Academy of Ophthalmology. For Pakistan, we have Ophthalmology Society of Pakistan, American University Professors in Ophthalmology. NANOS is for neuro-ophthalmology. We have all of these subspecialty conferences ongoing, NEOS, American Academy, ARVO, ICO. Then we have alumni networks, which can help you throughout this journey. Then we have published literature over there, YouTube videos, university websites. Again, you make the decision, you go on this journey. There are quite a few resources out there which you can utilize. So this was this one Facebook group of AKU Giving Back, from where I got all of these concepts, that it is so easy for a senior person to just pool these resources and provide them to you. But for students to go through and find all of these resources, it is very difficult. I know all of these societies, I know people in them, I've been through these conferences, uh, but you guys don't have the exposure. One of those very important conferences was for Islamabad. We have Bourbon conference organized by OSP. I believe it comes. I think it was a few months ago, but again, as a new upcoming vision I group, you can pool all of these resources together, and you need to know when and where the conference is at a national level. You just go there, you interact with people, you develop your interest, and even you find um, ophthalmologists from all around the world in these conferences. You connect with them. So this is a very good resource to go to these conferences. So Bhuban, Karachi Ophthalmology Conference is coming up next month in Karachi. Then we have Hyderabad Conference, which comes 1 month after that. Then we have Lahore Ophthalmology Conference, which comes somewhere in December. All of these connect all of the ophthalmologists throughout Pakistan, and you can go there. You can not just go there, you can also present in these conferences. So if you really want to level up your game, you submit your abstract, you present as a medical student in these conferences, and you put it on your CV that I presented in these conferences, these cases, and all of that. So this is something we are also starting with the ophthalmology interest group at AKU, which was also recently formed 1 or 2 years ago. And again, similar to Vision Group, they have the same to bridge the gap, to assist the medical students in research opportunities, everything, in acquiring the skills and all of that. So you can, you know, use these other interest groups, develop collaborations with them, and use these conferences. All of that, these are all available things. This was another very excellent resource, American Academy of Ophthalmology. This contains a global directory of training opportunities. So globally, across the world, anywhere, everywhere, they have a directory mentioning all the residency programs in the whole world. So 860 results. So again, it's up to the talented, competent applicant to go through all of these and secure their seat anywhere. These are the resources you can use. This is AUPO, American University of Professors in Ophthalmology, mentioning all the fellowship opportunities in the US. After you suppose you've done your residency in your home country, or um, in any case, getting to know them, these resources, going through these websites, it's a whole experience which will open up your mind towards pursuing this. So we have cornea, glaucoma, medical retina, neuro-ophthalmology, oculofacial plastics, oncology, pathology, pediatric ophthalmology, surgical retina, uveitis, and all the details I mentioned on their website. Right. So this was another excellent resource. So this is, if you look it up online, University of Utah, Google it, non-traditional pre-residency fellowship programs. This is a list of 15 research posts which you go through. They have this contact numbers mentioned here, email IDs. You email these people. These are research fellowships, right? So what you need as a step one for US is to get affiliated with the department, whether it's paid, unpaid, research position, anything. You need an affiliation to get into the system. So this is a good opportunity to get into a research post. You email them, you discuss with them, they interview you, you discuss the finances, the stipends, or if it's available, or if they don't have the funds, whatever. But that is all under discussion, right? So this is an excellent resource. You can Google it. 15 research posts are listed here. Email all of them multiple times, get your answer, start a research post, and that would be your first step into US. So this is something beyond your level, the fellowship models, but generally I wanted to say that um, fellowship after doing your residency in home country, that is still an option which you can pursue in the US. Me, for example, I was doing all of this homework. I am now currently, going for the fellowship after doing my residency in Pakistan. This was everything which I went through online, and I realized all of these concepts. So this is also an option, right? So if you do your residency here in Pakistan, then you apply for fellowship in the US or in other countries, you can pursue that as well. So these are a few fellowship case examples. My program director, Dr. Sami, he said that he had a fellowship in retina, clinical and research fellowship. It was a mix and match of clinics and research. It was on a J1 visa, and he did not have USMLEs because it was not a requirement. So you understand that at that level, when you have completed your residency, you are a skilled ophthalmologist. They want you to come and do research as a skilled ophthalmologist. They want you to even do clinics as a skilled ophthalmologist, and you don't need to give steps. There are certain programs which say that you don't need to give USMLEs, but the concept is you go there, you learn, you acquire those skills, you come back to your home country, and then you serve your home country. So in that aspect, you do your residency here, you go there for fellowship without giving your steps, you get affiliation with the department, you have a whole fellowship, 2 year, 3 year fellowship in the US, then you come back, and then you are on a whole other level of ophthalmology. So this was again a new concept which I was, you know, I realized. So the again multiple options. This was another IMG I knew from Lahore. He also did not have these steps, but he got affiliated with University of Utah. He did a 6 month fellowship on a B1 B2 visa in uveitis. Again, uveitis has a lot of vacancies, and he uh, got that fellowship from US without steps. He came back, He was a very competent, excellent clinician with a fellowship from the US, and he got good job prospects here. So again, a different concept you can start thinking about after you're done with the residency. At the IMG, Egyptian graduate, similar case example. And then we have a very senior, very excellent clinician, surgeon, Professor Moeen, very well known. He's a professor in Lahore, and he had his steps. He did his fellowship from University of, I think, I'm not sure, but again, his advice was after doing your residency, apply to a lot of programs, decide if you want to stay in the US or you want to come back. Different aspects you can think about after doing your residency in Pakistan and then moving to US. All of these concepts are available. And these pre-residency fellowship programs, these are applicable not only at a medical student level, even after residency, you can apply for these research posts to get affiliation and acquire the not the surgical or medical skills, but even research skills are very important nowadays. So, um, wrapping it up with final some advice. The first thing I would like to say is attend your local ophthalmology conference. Bhuban conference has passed recently, but we have upcoming Karachi Ophthalmology Conference. We have Lahore Conference and other places as well in Pakistan. Easy to go. And the first time you just go and attend, second time you present, and that's how you start building and you go into your journey. Then publish a case report with a resident. This is a very excellent concept which I want to give to you as a whole group society. We'll get to that in a minute. Choose your mentor who has gone exactly through this journey. Um, Again, I haven't done the residency in the US, but for a fellowship, I can give lots more advice. But you need to have a mentor and you need to copy paste things from them to make it simpler, easier, right? So we have people from Vision here as well, right? So this was a project which I started with the ophthalmology interest group at AKU, and it was a concept which I came up with, a model for UGME and PGME collaboration in research, undergraduate and postgraduate. So the concept was that we as residents, we present cases on a daily basis. Every Monday morning, we have a case presentation at AKU, and six of our residents, we have six residents, each of them have a rota. Every Monday, they present a case, right? Some of them are good cases, some of them are not so good cases. That's fine. But every Monday, they present a case, right? So we have pooled, I told my the ophthalmology interest group to pool the dates of each Monday in the whole past year, right? And then know the diagnosis, know the resident who presented it, and then make a decision with the supervisor whether it's publishable or not. Every Monday, a case is presented. कोई एक केस अच्छा नहीं है, दूसरा, तीसरा, चौथा. At some point, you will find that this is a good case, this is a good, excellent publishable case, which has already been presented by the resident. They have prepared a PowerPoint slide with good quality images, with all the the things required in the case report. They've been pulled together in a PowerPoint, right? Just like I showed you 3-4 cases. So I presented them naturally. So as a medical student, you go up to the resident, the chief resident, the supervisors, you make this connection, and then you assign a student, anyone amongst you, whoever it is, and then you have a formal meeting. The whole team has a formal meeting. You decide, okay, this case is publishable. Let's finalize a journal. Let's finalize the authorship sequence. Let's have a few meetings, and then the student starts on as first or second author, writing down the manuscript, getting it reviewed with the resident, then forwarding it to the supervisor, and eventually submitting the case. A case report is a very basic thing. You should know at your level how to publish a case report, and this was again a concept. You have many other resources out there online which can help you how to, but you have to, that's the first step. A simple, basic, good case report published by your name will show on your CV or will show your interest in ophthalmology and everything. So this is just something we can do as a group uh, for vision. So in conclusion, this is definitely doable. You need to gather all your information. You need to make that crucial decision which will filter out everyone else. You need to connect with the right people and groups. You need to work hard on your steps, work hard on research, and in any case, fellowship in the US or elsewhere abroad after doing a home country residency is always an option for most of those subspecialties. And this was how I organized myself during my residency, multiple multitasking at the same time, pursuing the fellowship, step three, research and residency, again giving my exams during a residency, and this is all. Thank you very much, and we are now open for questions.
Hi, so we have compiled the questions on Google Form, so I'll be asking them.
Can we have just 1 minute?